the other thing nurses need to do is ask questions. Always ask questions, whether it's asking doctors and respiratory therapists, pharmacists. I love picking their brains. Just continually ask questions. Become as smart as you can be. And then remember to read at least 15 minutes a day. Just 15 minutes. Pick if you had someone come into the emergency room with pancreatitis and, they develop respiratory failure and their calcium levels low, their glucose is 400. Read up on pancreatitis. Find out why all that happens. And it's only 15 minutes a day. And after 6 months, after a year, after 5 years, after 10 years, you can hold your head so high because you got the knowledge.
Hello, and welcome to the Art of Emergency Nursing podcast. This is where we share stories for inspiration, entertainment, and encouragement, because we all know emergency nurses have the best stories. Now here's your host, Kevin McFarland.
Hey everybody, Kevin McFarland here from the Art of Emergency Nursing. Thanks as always for listening to the podcast, and thanks for downloading this episode. Don't forget to leave us a rating and review. You may not realize, but that really helps the show out and makes it more visible to other nurses just like you. And as always, don't forget to share the podcast. Share it with people you like, the people you don't like. Share it with everybody. On this episode of the Art of Emergency Nursing, I interview a nurse with over 50 years of ER, critical care, and nursing education. She shares with us a little bit of her journey from bedside to her current role in education. We talk about some of the challenges she faced during the pandemic and her constant advocacy for nursing. You may know her name from her CEN reviews or CCRN reviews, which in her words have been around for a really long time. You are going to love this episode with my friend Laura Gasparis Vonfrolio. So again, I'm thrilled that we're going to get the chance to do this. You need to know that the very first, before I even knew what the CEN was, someone shared with me your CEN review book.
Okay.
I remember it was a little kind of half-size booklet CEN review. And before I even knew what the CEN was, before I was even a nurse, someone was like, here's this great book that's got a bunch of emergency nursing stuff in it.
Uh-huh.
So,
it's been around a while.
It's been around for a while.
It's been a long time.
It's been around for a while. So how long have you been a nurse?
Over 50 years.
Holy cow. That's a long time.
I know, and I just left, when did I leave the bedside? March 10th, 2020.
Okay.
And I really didn't want to leave, but I was sort of forced to leave because at that time it was the COVID time, and the hospital ran out of PPE. So they told us that we had to wear, they got us these bandanas with these little koala bears on them. And we were supposed to wear that. So I said, I'm not the brightest star in the sky, but I can tell you, I think bacteria is going to come through the bandana, all right? I think that's fundamentals. So I went to Home Depot and I got an N99 mask. And it had like these things on the ears and, it looked like a space suit. But anyway, I got the N99 or 98 mask. And I wore it into work. And I was told that I can't wear that. I have to wear the bandana. So I told them, listen, I'm over 70 and I have 1 foot in the grave. My husband might have like 1.5 feet in the grave. And I don't want to kill anybody. So I would feel better if I wore this. And they said, no, you can't wear an N95 mask. You'll have to wear a bandana. And so I left. But what amazes me is the nurses I'm working with, they're all concerned. They got mothers and fathers home and sick kids, and they got to wear a bandana. They're going to bring the germs home. So everybody was complaining, but I was the only one that left. Why didn't everybody else join me? But what a stupid question to ask. I've been in this profession for over 50 years, and no one will ever join you. Okay, so that was my last day of work, which is sad because I really wanted to work until I keel over.
Yeah. If you would have stayed, it may have been sooner. I mean, you may have keeled over before while you were still at work. So
I know.
It was kind of crazy during COVID. It was kind of crazy, the mask, don't mask. I joke all the time, and I do a couple talks, and I did a lot of media during COVID. And one of the things during COVID, I got on very early on in COVID, I got on and I said, you don't need to, to the general public, you don't need to wear a mask. Don't wear a mask. Save the mask for the healthcare workers.
Right,
There at the time, everyone was buying up the masks, and everything was saying, no, 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 don't do that. Just, you know, you don't need the mask. Save the mask for the healthcare workers. And then
right,
about a month and a half later, I did media on the same TV channel, and I said, no, 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 go ahead and wear that mask.
right.
So, I
It was terrible. I think the worst thing of it all, because I'm a critical care float, so I float to the ICU, MICU, open heart, ER, so I float. And I had the hardest time, and of course, this are the rules, with the rule that family members cannot be with the patient.
that's
So
yeah.
I broke those rules. And I'm surprised I didn't get fired. But, I told the people I work with, I'm going to break the rule. And if you blow a whistle on me, you better fear for your life. That's it. So, for example, I got a 33-year-old father of three dying of COVID. Yeah, he was on 100%. Yeah, he was dying of COVID. And they wouldn't let his wife in. So I gave him my scrubs. I gave him my name tag. I said, with the mask on, no one's going to know. All right. So here, go home, get changed, come back, and you stay with your husband. You stay with him until stay with him. And so she did.
True.
And I just told people I work with, I'm breaking the rule. But you can make like you don't see anything. Okay. She's not going to come out of the room. All right. And that's the end of that. But it's just unfortunate as nurses who were supposed to be patient advocates. We didn't let family members be with the people the family that's dying.
I
And what reason?
I can't
It's
even
a medical
imagine.
thing.
I can't even imagine. So I remember during during the heat of COVID, my wife is a double lung transplant recipient. So
Wow.
she's a double lung transplant recipient, and she started getting kind of the sniffles and didn't feel good. And I was like, holy crap, this is going to be terrible. And I remember dropping her off at my hospital,
Mhm.
and then very clearly saying, you can't come in. And I was like, this is crazy. So, and she went to the ER, and I dropped her off at the ER, and she of course got admitted immediately and got tested, this way and that. And they finally were like, okay, you're good. You don't have COVID. Get the heck out of here as quick as you can.
Yeah.
And they threw
Yeah.
her out just as quickly as they can. But I remember like that, 12 hours or whatever waiting to kind of hear everything. Like I was terrified.
I
And
know.
just thinking like, how can you not be there for your loved ones at such a
Exactly.
critical time?
I
But
know.
but I'm always amazed. I'm always amazed even now. We had somebody pass 2 days ago. And we're of course it's 82-year-old mother who's been neglected for God knows how long. And she codes, and then suddenly they like, oh, full code, we love mom, make her full code, do
Right.
everything you
Right.
can. And I think people don't realize what everything you can really means.
Right.
uh, and then sure enough, when we go through a half an hour of resuscitation, and we're like, no, really, we're done, we're done with this, we're not doing this anymore. And they're just kind of like, oh, shocked and devastated, but not shocked and devastated enough that they can get there that night. So they're like, well, we'll make arrangements to go see her at the funeral home whenever. And I said,
Right.
well, all right, okay.
All different kinds of people.
All different kinds of people. It
All different
amazes me.
kinds of people.
So yeah, I'm always amazed at family members, and you think you'd want to be there, you think you want to do all the things, and
Right. Right.
some do,
Right.
and some don't.
Right. Right. Yes.
So, but
Hmm.
so
That's
your
funny.
background, so tell me a little bit about your nursing journey. So you've been a nurse for 50 years. Holy
50
cow.
something, 50 something years.
And
Always in critical care, ER. I did more staff development, but I particularly like critical care and ER. Um, I was a tenured professor for about 12, it was a 12 or 15, I think I'm going to say 12 years. But of course, at that time, I was still working as a staff nurse. I I've been president of the National Nurses and Business Association for 10 years. Yeah, I've done a lot of stuff. I led the big march on Washington back in 1995. I don't know if you saw it on YouTube. I had 35,000 nurses. I got Pennsylvania Avenue closed down so we could march. It was a Friday when Congress was in session. And the reason why we were marching is because I had legislation in Washington, HR 1911 bill, and it was for nurse-patient ratios. And this was all before computers, so we didn't have any social media or anything. But I was able to get 35,000 nurses there. Pennsylvania had to close down. We had a march. And really, the only state that benefits from that is California, because right after that, California initiated nurse-patient ratios. Most nurses, when they went back to their hospitals, some nurses got fired for going to the March on Washington, if you can even believe that.
Wow.
Yeah, can you imagine? Hi, you're in America. And so a lot of nurses were afraid to do things with it, whereas California went to the state senator and Congress people, and they initiated the bill in California.
That's fantastic. Holy cow.
I know. And there's been numerous bills in every state, but nurses voted down. Like in Massachusetts, they 2 years ago, they had nurse-patient ratios, really good ones, like in a critical care environment, 2 patients to 1 nurse. On a med-surg unit, it was 5 patients to 1 nurse. They were pretty decent. And it got voted down because many nurses believed that if the hospital hired more staff, they would lose a lot of money and the hospital would go out of business and then nurses wouldn't have jobs. Hello?
Yeah, like one of the things I've never feared was job security. I never felt like I wasn't going to have a job. Never in my life.
Exactly. But somehow you can brainwash a group of women to believe that this is going to happen. I hate to say it, but I said it.
It's unfortunate. It's unfortunate that it is that some nurses are that short-sighted. Like you just don't.
Oh yes.
Yeah, I mean,
They
to me now, I would never think that I would ever have any kind of job insecurity. Like I gotten fired from a job, and I was like, sure, yeah, fire me. That's okay. That's fine. I have another job. I have another.
Yeah.
I had a PRN gig that I was like, the day I got fired, I called up and I said, hey, can I work tonight? And they're like, yeah, you bet. Come on in.
Yes.
So,
They always move on.
yeah, it's
I've been
easy
fired from 3 hospitals, so. But
Yeah.
I would want to say, I do want to say that from every hospital I got fired from, I always got my job back because I
Yeah.
sought legal action. So, for
Yeah.
example, one hospital on Staten Island fired me because I unionized them because the working environment was absolutely disgraceful. They were doing mandatory overtime. And I think the thing that broke the camel's back is this woman, a young girl, was pregnant, 8 months pregnant, and she worked the 3 to 11 shift. And her ankles were like, elephants, all right? And they told her she had to work another shift from 11 to 7. And she said, well, I can't. I got 2 little babies at home. I'm going to give birth any minute now. And my husband leaves at work at 6, so I really can't stay. And they said, you either stay or you'll get fired. And then she said to me, well, I can't get fired because my husband doesn't have health insurance. I'm going to give birth. So I told her, listen, Diane, you go home. I'll work your shift. So she went home. I worked the 11 to 7 shift. And I said to myself that morning, no more. So I started a union, Richmond County Nurses Association. And I unionized the hospitals on Staten Island. And I got fired, but I sued. I went to court and I won. Got my job back.
You're like, okay, I'm back.
So that was a good time.
Oh,
Remember I went to the director of nursing. I went into her office. I put my feet up on a desk. And back then you could smoke in the hospitals. I don't know how long you've been a nurse, but
not that long.
Well, back then you could smoke everywhere. And so I remember I lit up a cigarette. And I told her, I said, listen, you think you got rid of me? You're written, okay? I'm going to be a nightmare in this hospital. So we unionized the hospital. We had a really great contract, no mandatory overtime. It was absolutely fabulous.
Good for you.
Yeah, so I've done a lot.
Sounds like it.
I've done a lot.
Okay. So tell the audience what you do now.
Right now I teach at Wagner College. I teach nursing students, and I teach them to stand tall, answer back. Just don't be intimidated. I like to build their spirit up. Whereas what I see in nursing schools is most teachers break the spirit. So I like to build their spirit so they have a lot of confidence. And then I also have a company called Education Enterprises, which I have the last 40 years. And I go around the country doing seminars, CCRN reviews and CEN reviews. And so I do that, not too much now, maybe like once or twice a month. And I teach at Wagner, and I have kids, believe it or not. I got pregnant at 53.
Wow.
I know. I almost made the cover of the Inquirer. And so my children are 20, so, I'm still like a mom. So I'm pretty busy.
Sounds like it.
I know, right? 53. And to think initially, they told me, well, what happened was I took in 7 foster kids under the age of 9.
Holy cow.
And my foster baby was just born, and he was born on crack. So he was up all night screaming, and so I just held him 24 hours a day. And I had run into menopause at 40, and now at 50, by 52, I start nurturing this baby, and it somehow got me out of menopause. My vesicular stimulating hormone acted up. Anyway, I wound up getting pregnant, and my stomach started getting big. And, you go to the doctor, say, what's happening here? He says, what are you eating? I said, chicken nuggets and macaroni and cheese. He said, that's why your stomach is fat. Go home. Then I started getting tired. They said, what's your life like? I said, I have 7 kids under the age of 9. So they said, well, that's why, go home. And then it started getting really big. So then they did a sonogram, and they found 2 rapidly growing tumors, which happened to be baby A, baby B. And it's only when I went for a chest x-ray did they determine the tumors were babies.
So you had twins at 53?
Twins.
Ooh, boy. Talk about
Yeah.
a lifestyle change.
I'll say, well, I had 7 at the time, so 2 more. What the heck? 9 kids. Well, you have 7, you have 9, it's all the same.
It's also. But that had to be an exhausting pregnancy. Holy cow.
It wasn't that bad. I mean, the first year was bad, just feeding 3 babies, every 2 or 4 hours. But after that, not that bad.
Good for you. And born healthy, happy, good?
Everybody, born healthy, happy.
That's
And
fantastic.
girls, though, so it's a little different than boys. My boys were foster boys, so raising boys and girls are very different. Boys are easy.
I'm sure.
Girls are a lot of drama.
I've heard that. I've heard that. I don't have kids myself, but we've certainly heard that. Raising boys was a little bit easier than raising girls.
Yeah, I mean, they make a mess. They're loud. They're bouncing off the walls. The girls, a lot of drama. They remember things from 3 months ago. So tell me now that you don't have kids.
Yeah, I'm gonna just be quiet about that. Remembering things from 3 months ago. I'm not gonna say a word about that.
All right, be careful. 53 over here.
That's right. That's right. I'll end up in trouble here. So, what got you into starting teaching and doing the speaking thing?
I started doing that. Let's see, I think I was staff nurse for about maybe 8 or 9 years. And then I decided just to speak locally. And then it just mushroomed, and it really mushroomed, really took off. And then I decided to form a company called Education Enterprises. And and just go on the road. And I did that a lot years ago. Now when the kids came and now I'm old, I really don't go on the road that much, maybe 2 or 3 times a month, maybe 4. But years ago, I just started doing local and then it just took off.
Good for you. That's awesome.
Yeah, and back then things were different. Hospitals paid for education back then. So I would have 150, 200 people, 500 people at each seminar. It used to be big crowds.
Yeah.
Now, after COVID, at least in New York, I can't get a conference room. So it's really hard. And then a lot of hospitals don't pay for nurses, and then the nursing shortage. So the environment is different. So now rather than going to hotels, I go right to the hospital and I do my seminars.
Yeah, I think education has changed a little bit post-COVID. I think we got so used to doing online education that I think it's been a little bit tough getting people back in the classroom.
Yeah.
Getting them back in the classroom and getting them back to, they wanna do these Zoom learnings. It's just I just don't
Yeah.
think they're, and I do them, but I just don't think they're quite as effective as in person, you know?
No, a matter of fact, in my college, they were doing Zooms in 2021 and 2022. They were doing Zooms, and I
Yeah.
refused. I
Yeah.
made it in person.
Yeah.
If
Yeah,
you want
it's
to know Med Surge 1, Med Surge 2, you're going to have to be there in person. And you know what? If you're going to be a nurse, you really can't be afraid of germs. Because if you are, you shouldn't be a nurse. So
it's
I
true.
was like the only teacher showing up in person.
It was, just as the kinda tail end of COVID, I started teaching at the college, and I was doing a clinical group, and we had the clinical groups in the hospitals where they were just starting to get back in the hospitals, and I remember telling the nurses just that, it's like, "Yeah, I know there's germs, there's disease out there, but, like, this is what we do, we take care of
Yeah,
patients." So
yeah. Not trying to be nervous about a little virus. There's far worse stuff out there, all right?
yeah, absolutely, absolutely. So, it's, so it's been a little different. It's been a little different with education. So I do, I do some teaching with, I do some speaking at different conferences and stuff, and then I do 1 and 2 day reviews, myself. And, it's been tough getting people back into the classroom and used to that
Right.
again. And I think you're gonna learn more if you're, sitting in a room interacting with your peers and
I
really
agree.
engaged.
I agree.
Because when you're on Zoom, you got too much of this going. You're on the phone,
Yeah,
you know,
yeah,
you're distracted, you're out, I don't know how many
yeah.
times I've seen people with their laptop in, like, the kitchen as they're doing stuff, and
Exactly. Yeah.
I'm like, "You're not gonna learn that way."
That was not learning.
So,
Yeah. So I'm glad that calmed down.
yeah, yeah,
Yeah, well, there's still options. My 2 kids are in college and they have an option of taking it online or in person.
yeah, yeah.
So most of them kids take it online.
And I think online learning is good for some stuff, but, like,
Right.
I think for, like, certification reviews and for stuff that's, like, gonna be real actionable, like, it just doesn't seem to me like as good of an idea.
I agree. I
So,
agree with you.
it's how I've always felt about it. It's one of those where, like, I don't know, I just think call me old fashioned. I just I wanna be there and, you know, ha
Yeah.
have the book and write the notes and do all the stuff. So,
Right. And be animated and get them engaged and be spontaneous. That's why I left the sham person for my class. That's it.
yep. Yeah. Now I've never seen you in person, but I've seen videos of you teaching, and you are hilarious when you teach, and you're so interactive and engaging. That how do you not learn in that environment?
I try to be entertaining. I mean, they're there for 7, 8 hours.
It's
You gotta
hard.
crack jokes to
Absolutely.
tell stories, and you have
Yep.
to.
One of the things I realized pretty early on in my career is that, there's gold in those nursing stories, right? Like there's
Right.
those stories the nurses share with you always have those little tiny nuggets that if you pick that up,
Right.
you're not gonna make that mistake that someone else maybe made. You're gonna learn that thing that they really want you to kinda learn, and I've always found that storytelling is a great way to teach.
Right.
So
I agree.
so what made you decide to get into nursing? Why nursing?
I wanted to be something fast, and I was at Pace University, and I was in my junior year, no, my senior year, and in April, which is only 2 months from graduation, I decided I didn't want to be an accountant. And so I dropped out. Can you imagine?
Holy cow. I bet your
I
family was
I
floored.
always wanted one of parents were made it. Now I'm a mother with 2 kids in college. I'd freaking kick their ass in if they told me they were, we're going to leave 2 months before graduation. But I just left. I couldn't take it anymore. And I said, what can I do like quit? So I said, oh, let me do a nurse because I got my associates first. And that was only 2.5 years. So I became a nurse. And then I really liked it. So then, I went on for an associate, a bachelor's, a master's, a PhD, and I just, kept on going. So
That's
that
awesome.
was it. Thank goodness I left accounting. So what made me do that?
And what made you decide to get your PhD? So one of the questions that people kind of always ask me, everyone always asks me about kind of going back to school. And I'm always like, it depends on what you want to do and what you want to do with it.
Right. Right.
What made you decide to get your PhD?
Well, I got mine a long time ago. I got mine, I started in the 1980s. So that was a long time ago. And back then, they either had a PhD or an EDD. There was no such thing as NPs or DNPs or any of that. And so I decided to go for my PhD because I was working as a tenured professor. And one of the requirements in City University is to be going for or to have your PhD. So that's why I did my PhD, because I was teaching at the college of Staten Island at the time.
Makes sense.
Yes.
They were really probably pushing it at the time. So
Right.
so that long ago, there probably weren't a whole lot of PhD prepared nurses.
They were only, at that time, I finally graduated, I think in 1992. I read to me like 10 years, 1992. And there was only 200 nurses in the United States with an EDD or a PhD.
Wow.
Yeah, we were pretty non-existent, but it did take a long time. Initially, I was at Adelphi University, and I had a little difficulty there. I couldn't get through my dissertation because you need 3 people to vote yes,
Yeah.
And chairperson disliked me terribly for a lot of reasons. And so then I did all my coursework, but I couldn't get my dissertation approved. I wound up getting it published in a book. It was called Nurse Abuse, Impact, and Resolution. So even though it got published, he still would not approve it. So then I had to go to LaSalle University and finish my PhD there. And it's interesting because the dissertation I did on that, because I decided not to use the same one, is I did it on computer, it was called CAT, computer assisted training. Now, this was before computers now. All right. So my vision is, I had the VHS tapes out at the time, and people put them in their television and watch me.
Yep.
So I said, why don't they do this for school? Like if I'm the University of West Virginia and I want to get more people enrolled in my school, why don't I put some courses on VHS tapes and have the student watch it, take a post test, and let them graduate from my university from West Virginia when they live in Colorado.
Yeah.
So this was like the brainstorm I had. And so that was my dissertation. And then years later, they came up with online education.
Now that's how everyone gets their degree. Like everyone's oftentimes people are not in the state where they're getting their pursuing their degree.
Yeah, I miss, I was born a little too early or something. I don't know what happened there.
Born a little too early, maybe.
Too early.
That's right. That's right.
Yeah, I should have met up with Bill Gates or somebody. They could have taken my idea and flew. You know what I'm saying? I missed an opportunity.
Right.
But I got the dissertation, so I got the PhD, so big deal, But it's interesting, I was working as a staff nurse in the hospital at the time, as well as teaching at the college. as well as going to school. And when I finally did get my PhD, the hospital sent out a memo to every unit in the hospital saying, should a registered nurse obtain a PhD in nursing, that nurse may not be addressed as doctor, in that this would be too confusing for our patients. So rather than like having a little cupcake saying or a cake or pat me on the back or give me a slice of pizza saying, congratulations, they send out the memo saying you can't tell me Dr. Vonfrolio because it would be too confusing for the patients. Rather than saying congratulations, God forbid you get a pat on the back as a nurse in the hospital.
Yeah. Yeah. It's kind of funny. I'm a pretty active member of ENA, and ENA just kind of had that debate again, probably for the umpteenth time, just had that debate about whether or not nurses should be able to use their doctorate titles in the clinical space.
Mhm.
And,
Yeah, I
there's,
think it's clear that you're a doctorate and you're a nurse. So
yeah,
we're saying you have a doctorate in nursing, as long as you're clear with your patients, and as long as on your name tag it has RN, some nurse doctor people think that, they're doctors, so that's a little scammy. But if you're very clear with patients that, my name is Dr. Monfolio, and you say, I'm a registered nurse and I went on for a higher degree and, blah, blah, blah. I don't have a problem with that.
agreed. Tell me about a patient that you'll never forget that you took care of.
I do have a patient that I'll never forget. Her name is Maria, and she was the chief of nursing at the government hospital. And I used to work there. And, back in the 70s, you did not have to get consent to experiment on patients in a government hospital.
Wow.
Yeah, you
Wow.
could just experiment on them without them knowing it. Okay. So there was a doctor who I knew he was a moron, but devised some kind of concoction that he would go around giving IV patients because it supposedly was going to get him off the ventilator sooner. And everyone I saw died. So anyway, he was going up to my patient, a 95-year-old patient, and I'll say her name because back then there was no HIPAA. Her name is Mary, and she'll be happy I'm saying her name. And he went to go give her the injection. So I had told her about this injection prior to him going there. I said, listen, Mary, doctor's coming around, he's giving an injection. I don't see good results. So if he comes over and asks if you want it, just go like this and tell her no. Right? She was intubated, but alert and oriented. So he came over and was going to give it to her, and she was waving to him like this. So I went over. I said, listen, she doesn't want that. So he said, well, she's an old lady. What does she know? I said, she's alert and oriented. She knows she doesn't want it. He said, well, I'm the doctor. I said, listen, I'm going to prevent you from giving that injection to her. So I put my hand on his hand so he doesn't get the injection. And he hit me with his elbow and it knocked the air out of my lungs. I was like, ugh. And then after I came through, I decided he touched me, I touched him. So at that time I was putting jujitsu and I was a brown belt. So I just hit him a few times, just like 2 times, over here and over here. And then he went unconscious. Okay. So it's so cute because Mary Fisher, she was like, yeah. So he had to get 18 stitches. And then, of course, the security of the hospital came to remove me. But I called the police department because he hit me first. But then I was informed that because it's government property, the police department is not allowed on government property.
Oh, yeah, it's probably federal.
Yeah, it was federal government. So anyway, I got escorted out. But the good thing is when they escorted me out at 11 o'clock that morning, 32 critical care nurses walked off with me. So they had to close CCU, they had to close MICU. Anyway, so they transferred everybody. Where did they put everybody? They put everybody in, I think, step down or something. All right, 2 weeks later, Mary says she gets out of the hospital. So I look up from the sidewalk, because that's what we had back then. I get in touch with her. I said, listen, Mary, I want to take a ride down to Washington. Want to come with me? She said, all right. We took a Greyhound bus down to Washington, D.C. We went into HEW, the building, and I filled out a report. And against that doctor did an investigation. They found that he searched his medical license, that he was never a physician.
Oh my God.
And, so great things happened. Now, meanwhile, Marie Anthony was the chief nursing officer. That's what they called him. And, she fired me, of course. 10 years go by. I'm working at Staten Island Hospital, another hospital. And she came into our unit. All right. And so as soon as I saw her name, I was, oh God, she's going to drop down when she sees me. I'm such a buster, And her husband comes over to me and says, Laura, Gasparis Vonfrolio. I said, yeah, why? He says, my wife wants you to be her nurse. I'm like, are you kidding me? She fired me. She said, no, she wants you to be her nurse. I'm like, why would she want me to be a nurse? Because she's afraid she might die. And she knows that no matter what, even if it means risking your license, you will save her.
Wow.
And so I was Marie's nurse. So that always stuck in my mind that, despite what might happen, stick to your guns and always do the right thing. And here was a nursing executive who realized that, and on her deathbed, she allowed me to take care of her. So that I will never forget, and always gave me the lesson: just stick to your guns and always do the right thing, no matter what.
How do you, so as a nursing professor, how do you instill that in nurses now? That patient advocacy, that importance of patient advocacy, and the importance of doing what's right for the patient at whatever risk there might be.
Well, I tell my students, it's okay to walk away. My students graduate, or any student, any nursing student that graduates, I get a lot of calls of nursing students that say, listen, I'm working at NYU. I've only been there for 1 month. I hate it. I don't know what to do. Oh my goodness. I'm like, leave. I said, why do you hate it? The nurses are mean to me. The ones who experience don't want to teach me. It's short-staffed. I'm like, leave. So I tell my students, walk away. Never work in an environment where you're short-staffed, you're not able to give great care, and you're not appreciated by hospital administration. Walk away. And then some of the nurses I speak to say, yeah, but then, what am I going to put on my resume? Leave it out. Leave it out. If they ask you what you did 6 months after you graduate, tell me you went to Europe to visit the hospitals in Finland or something. We don't care. Make up something. Just leave it out. But don't be afraid to walk away. You don't stay in an abusive environment. Period. Shop around.
One of the things I always say is you got to know your worth. And sometimes your worth is you walk away and you're going to find it.
Yes.
So.
Absolutely. And that's what they have to do. And then the other thing nurses need to do is ask questions. Always ask questions, whether it's asking doctors and respiratory therapists, pharmacists. I love picking their brains. Just continually ask questions. Become as smart as you can be. And then remember to read at least 15 minutes a day. Just 15 minutes. Pick if you had someone come into the emergency room with pancreatitis and, they develop respiratory failure and the calcium levels low, their glucose is 400. Read up on pancreatitis. Find out why all that happens. And it's only 15 minutes a day. And after 6 months, after a year, after 5 years, after 10 years, you can hold your head so high because you got the knowledge to talk back. But you could say to physicians, I've been a nurse a long time, so a lot of times, I'm always saying, not on my ship.
We do have some crazy moments in nursing, don't we?
A lot. But that's what makes it interesting. Do you know what I'm saying? Yep. I just wish nurses would stick together.
We have a tough time with that.
Very tough time with that. Yeah, and the main reason is whenever you get a group of women because men act different. Whenever you get a group of women and you make them feel powerless, right? You give them no power, you make them feel powerless. Women will always exert horizontal violence, fighting among themselves, backstabbing, whereas men, if you put them in a situation where they feel powerless, they will lash out vertical, not horizontal. They'll just set the place on fire. Whereas women will, backstab each other, gossip, and I still do per diem, believe it or not. I was in a hospital in New Jersey doing per diem, and it was on a unit I was never on before. And these two nurses were ripping apart this other nurse who was in the utility room. I mean, ripping her apart. And they said, what do you think? Have you ever worked with her? I'm like, no, I don't even know who you're talking about. But boy, I think the best thing is to, she should have a conversation too. So I went in the utility room and they're like, where you going? Where you going? Where you going? I went in the utility room and I said, listen, is your name Claudia? I said, well, we got two girls out there and they're mentioning your name. I think maybe you need to come hear it. So I took her and I put her in front of the two other nurses. I think they were ready to drop dead. You know what I'm saying? So I said, no, you're talking about Claudia. Let's do oil in the laundry. What's the problem here? And then they said, well, she always leaves her room a mess. She does this, that, that a million complaints. So I said, well, let's talk about what's good. What does she do good? Because I used to be a charge nurse, and I've had, a lot of people who would come in my office and complain about each other. We all have strengths and weaknesses. You might be a top-notch calculator about glutamine grip, like that. Whereas this nurse is better with patients' families. You know what I'm saying? We all have strengths and weaknesses, and you really have to appreciate that in people. And that once you stop fighting among yourselves, you're doing exactly what the higher-ups want you to do. The last thing they want you to do is band together. That's the last thing they want you to do. And so they create an environment where you all fight among yourselves. I tell you, by the end of the shift, they were having Claudia. It was a wonderful time.
That's awesome. That's awesome. It's funny how if you can just kind of get past the first initial differences, you just talk things out.
Yeah.
It usually works out
Strengths and weaknesses.
because we all have them.
Yeah.
What's the best advice a mentor ever gave you?
The best advice a mentor ever gave me. Well, my mentor, who is still alive, right? She's in her night. I'm Facebook friends with her. Esther Winterhalter. She's still alive. She's in her night. I think she's 98. She was my mentor as a nurse. And she was the most kindest person you would ever meet in your life. And I learned from her is always realize what it's like to have a family member in the hospital. Always think of a patient as your family member. And it really, I guess, solidified when I had family members in the hospital. I'm like, whoa. And so it made me a better nurse. It made me a more compassionate nurse. I was also intubated. I went into anaphylactic shock and I was intubated, and that experience made me a more compassionate nurse. So there's things that made me a better nurse. Esther made me a better nurse. And being intubated made me a better nurse, that's for sure. My God, that was horrible. I don't understand why as soon as you go in the ER, they got to take the clothes off. I went into anaphylactic shock. I'm having a breathing problem, and you've got to cut my pants and my underwear off. I'm having a breathing problem, and I had no plans of being naked. I had hair on my legs. I was very unkept. Anyway, and the other thing is that when you stop yes naked, you would think as a woman, I would keep my legs closed, right? Don't work like that. When you're hypoxic, your legs spread open really wide. You don't know why that happened. And so then it was just horrible. They couldn't intubate me because I went to anaphylaxis and my tongue was hanging out of my face, and they couldn't intubate me, and they were going to clear somebody in to treat me, but thank God he never showed up. So they wound up intubating me with those neonatal endotracheal tube, right?
Wow.
So they intubate me with that. They wrap the tape around my tongue. Then they do some Palladian line, right? And they're saying, just a little stick, a little stick, nothing. Anyway, and then after they put some Palladian line, they give me epi. Burns. You feel your right atrium burning, your right ventricle burning. I was like, oh Lord, take me now, take me now. And then I feel that burning again. And then I hear someone say, what are you doing? And then the nurse says, oh, I'm giving them that hit of epi. And then the other nurse says, oh, shoot, I gave it to her already. So now they're shooting back and forth. And now I got 2 hits of epi. And then they, in the middle of that, they're putting in a Foley. I had like 3 people between my legs, like they're having a convention. Like I think that day, if that's it, I think, I mean, how many options you have down there? And so the whole experience was really horrible. And then when I leave the ER, they use my head to open up every door. The double doors, the elevated doors, my head opened up every single door. Then when I get into the ICU, they say, you know, the bed's not ready yet. I'm like, hey, I'm going downstairs. I'll throw myself off the stretcher now, you know? So then the nurse says, oh, I'll clean it. You know, she didn't clean it. God knows what died there. But anyway, then I'm trying to move from the stretcher into the bed, and I can't because if you have a hypoxic, my O2 was 32 on ABG. I think that's what happened cerebrally to me. But anyway, and so whenever you build up in lactic acid, you're in a lot of pain. And so I couldn't move from the stretcher into the bed. And then the ER nurse is saying, come on now. Come on, we saved your life. Now you're taking all this time and people are going to die because you're taking so much time. So I wound up like throwing myself in the bed. The Foley came out. Now I can't laugh. I can never laugh. If I laugh, I have to wear a diaper. It was just, the Holy Spirit was horrible.
Oh my gosh.
You're a better nurse.
That's so what do you teach your nursing students now based on your experience as a patient? Like, what are your big take home messages for your nurses now, your students, that you say, hey, this is what you need to know from the patient perspective?
I teach med surge, but besides the content, I teach them that they have to stick together. Gotta stick together. Don't gossip. Don't backstab. Don't get into that at all. Read every day so you're smart. And just be compassionate and be a true patient advocate. You really got to be a patient advocate. I tell my students, stand up tall, stand up straight, stick together, don't start small talk, gossip, backstabbing, walk with your head held up high, and gain knowledge every day. Even if it's only 15 minutes a day, become the smartest human you could become, and then you'll be the best nurse you could become. And stick together. If you want to make any change in this profession, stick together. And that's my message to them.
That's a great message.
And also, don't ever think that administration is going to have your back. There are very few hospitals where administration has your back. I mean, I've been a nurse for a long time, worked in many hospitals. Administration does not have your back. They don't sing the same song as you. You know, they're working for the other side, which is unfortunate, you know?
Yeah. I think there's glimmers of hope out there. I think there's some administrators that really do
There's some.
want to do the right thing, but I think in
Absolutely.
general, it may not be as.
Yeah. Sometimes they get fired though.
We're on the priority list. We just might be a little bit lower on the priority list.
Right. But see, you know, it was interesting. The school asked me if I want to teach leadership. All right. Do I want to teach a semester of leadership? You know, because they think I have to march on Washington. You know, I'm a real leader. I'm like, there is no leaders in nursing. There's no leaders in nursing. We're a leaderless group. Because if we had nurse leaders in this profession, we would have had nurse-patient ratios 50 years ago. We're still complaining we're short staff. We're still complaining that the staffing is unsafe. We shouldn't have these discussions. So if we really had leaders, we would have had nurse-patient ratios. Period.
Not many states do have nurse-patient ratios.
Only California.
Yep.
Only California. I think Iowa, Illinois rather, has it for the units, I believe. 2-to-1 ratio. But that's it. Those are the only states. That's it.
Yeah.
Really California. Which is a sin.
Yeah.
You know?
It's unfortunate.
But hopefully it'll change so that nurses can give great patient care and be advocates.
Yeah. What would you, when you look back at your career and look back at your time in nursing, what do you hope that people looking back look at your career and what you've accomplished and what you've done?
Looking back, I just hope they get the message. I hope that people take away that my message is for nurses to have each other's back and stick together. That's my real message, and I hope I'm remembered for that. I hope I'm remembered for the message that there's power in nursing, but you have to stick together for that.
Yeah. Well, this has been a lot of fun, and I am so glad we got a chance to do this. This has been great.
Thank you for the opportunity.
Cross
Yes,
paths, that'd be a hoot.
yes.
So
And tell me I said hi. Give him a kiss for me.
I won't give him a kiss for you, but I'll certainly tell him you said hello, and
Give him a hug, Dad.
that I'll do. That I'll do.
Okay.
Bye-bye.
Bye.
Thanks for listening to the Art of Emergency Nursing podcast. Make sure to subscribe to the podcast and follow us on Facebook.